Department was one of the original 16 family medicine departments in 1969. It was originally started as a division of the Department of Medicine at the University of Minnesota Medical School. And then there was some political maneuvering, which led to its establishment as its own first family medicine department in 1969. The history of the department is probably exemplified by a famous phrase in family medicine called family medicine is counterculture. So it embraced things like biopsychosocial model of care, embrace of social determinants of health. It was unabashedly for health equity. When you talk about social determinants in medicine, we have always embraced those in family medicine. We go towards those concepts.
It's hard to imagine that thinking back 50 years now, half a century, and at that time I was one of the first residents in family medicine. And at that time, no one knew was it going to make it, what it was all about. But the excitement and the enthusiasm and all of the ideas, how are we going to go about this? What would the curriculum be like? How do you really prepare doctors best for this general practice or family medicine? In fact, there was a lot of debate about what we were even going to call ourselves in those days.
I remember the first day of medical school, people were like, what do you want to do when you're done? What's your specialty going to be? And I didn't actually know what specialties were. I said, well, I want to be a doctor. And like, no, what kind of doctor? I'm like, the kind of doctor that takes care of people. And they're like, well, what kind of doctor that takes care of? I was like, I want to take care of all the people for their whole life. And they're like, oh, that's family medicine. I'm like, okay, then I want to be a family medicine doctor.
I kind of think of family medicine as the quarterback of your healthcare. So the ones kind of calling the shots, knowing your whole background, knowing the whole field and what's going on, and directing you to the right places that you need to get to if you need that help.
One of the things that drew me to family medicine was seeing the relationships that they had with their patients, seeing families where they were able to see their kids grow up and take care of the grandparents, and so just being really invested in multiple aspects of the care of a community.
I think society in Minnesota is very much attuned to the importance of the generalist physician, and that's reflected in the legislature. They have also supported family medicine over the years.
5 years ago almost, I was asked if I would run for the Senate because healthcare is such a big issue. And there's no question that as a family physician, I've been able to have a real impact on some of the legislation that gets passed to the governor's desk. When I think of family practice, I think of it at multiple levels. I think of the individual docs in an exam room seeing a patient. But that doesn't happen without some network of teaching and training. You can't learn medicine in a classroom. You learn medicine in a residency program.
When I got interested in family medicine, everybody said, well, you got to go and look at the programs at Minnesota. That was just the place you went when you were interested in family medicine. We've got, this rich history of training physicians for the state of Minnesota, and also for the academic vitality of the field of family medicine. So proudly in this state, we have all of these residency programs training family docs for the state of Minnesota, in the cities, in greater Minnesota, small towns, rural areas, full spectrum family medicine.
I was in my small town in Montana, and one of my friends had her father was visiting. He was an endocrinologist, pediatric endocrinologist from Minnesota. And I was like, I'm thinking about going on faculty over at the U. And he goes, oh yeah, no, the U makes the best family docs. But it had the kind of reputation where, yeah, this is the kind of place where I knew I could learn a lot, even as being a faculty. And I knew that it was the kind of place that would help all of us get to the next level.
The University of Minnesota has been a wonderful institution for really giving us the opportunity to create the environment that could really not only replicate the doctor of the past, but bring the doctor into the future and integrate all this together.
Residency is just a really big opportunity to grow as a physician, and one of the things that it has really helped me to do is build relationships both in the community but among my co-residents, and then also the greater colleagues that I work with. And so I would say the biggest thing has been expanding kind of my comfort with reaching out to people and really doing things that I know will help my patients.
The most memorable thing about my residency wasn't one particular moment. It wasn't one particular night. It was one particular family. I followed her through her entire pregnancy, and her husband became my patient, and then I delivered her baby, and then I left the residency program and I moved to Chanhassen, and all three of them came with me to Chanhassen, and the family has just been such a blessing to me.
I look at my appointment schedule and see friend after friend after friend, and I know that I'm going to help them that day. But I also know that I'm going to be helped. I'm going to be sustained. That's the real joy of family medicine.
Family medicine gives one a vehicle where you can accentuate your own inclinations and give you a background and training in which you can carry those out.
And really the big thing is people realize that when you're trained in the University of Minnesota Family Medicine program, you are capable, competent, and committed. We have people that have been doing this for the last 50 years. And I think we actually do it better than anybody else in the world.
People of my age, we see things that medical students now, we think are miracles. Medical students think they're just everyday. This is the world. I think there are a lot more miracles coming down the pike. Specialties are going to grow. There's going to be more specialization in medicine. It's going to be an amazing period of time, the next 50 years. But I firmly believe there's still a fundamental human need for people who are ill, facing vulnerable times of their lives, for a thoughtful, committed, well-trained physician who knows you as a person, thinks of you as a person, has a holistic view of your health and healthcare, and is there to help you when you're in trouble. And I don't think that's ever going to go away.